What's up guys, this is EG. Today we're going to discuss diabetes insipidus, also known as DI. Diabetes insipidus is a condition that occurs when your body produces abnormally low levels of antidiuretic hormone. Remember that your posterior pituitary gland secretes ADH, which retains water in your body. With that said, DI is typically caused by increased intracranial pressure in the brain, often due to cancerous tumor or brain herniation. It can also result from surgical removal of pituitary gland, a procedure called hypophysectomy, or from brain injuries such as head trauma. So with DI, the posterior pituitary gland is unable to produce ADH, also known as vasopressin. So let's talk about the clinical manifestations. When there is a decrease in ADH secretions in your body, you will manifest polyuria, which is excessive urine output, and polydipsia, which is excessive thirst. Eventually, this will lead to fluid and electrolyte imbalances and severe dehydration. Because your body is losing fluid, this will lead to hypotension and tachycardia. Eventually, you'll end up with hypovolemic shock. You will also see symptoms of hypernatremia like altered mental status, confusion, lethargy, seizure, or even coma. All of these symptoms are related to dehydration. So let's talk about the diagnostic tests. The diagnostic tests that will be measured are urine-specific gravity and serum sodium. Again, urine-specific gravity is the concentration of particles in the urine. So, if you have DI, you're going to urinate a lot, then your urine-specific gravity is going to be low due to particles being diluted in the urine. What about serum sodium? It will be high because there's not enough fluid in your blood vessels, and the sodium particles will be supersaturated. This occurs because less sodium is being diluted in the plasma. The nursing management and treatment would address the clinical symptoms and abnormal lab results. So this includes monitoring your vital signs, especially your blood pressure and heart rate, measuring your urine output and specific gravity. We can administer desmopressin acetate, which is a drug of choice for DI. Desmopressin acetate is a synthetic version of ADH or IV vasopressin. This drug will help retain fluids in your body, decrease urine output, and elevate your blood pressure. Because you have fluid volume deficit, you're going to need lots of fluid, either from IV or PO. Because of hypernatremia, we need to initiate seizure precautions and frequent neuro assessment, and of course, look for signs and symptoms of dehydration. We can also give you hypotonic solutions like the D5W to replace the fluids and correct the serum sodium. However, we need to monitor your blood glucose because hyperglycemia can lead to osmotic diuresis, which worsens dehydration.